Is your Team Redstone town hall and some COVID-19 update. We welcome your questions today. I will tell you, we are ready to answer some questions, but as far as what we've been given to start off with this morning is really, I've only got 5 questions. Colonel Meador's only got 2. So we will rely on you to come up with good questions that have not already been answered in the messaging bar this morning, and we will then try and get to some of your questions. First, I'd like to thank you all. We have been doing this for about 4 weeks now, and throughout the surrounding community, we have noticed in Madison County and the other 16 counties that provide your community. We have noticed, I won't say a dramatic drop, but we have not seen the rise in cases that we had expected. So our social distancing efforts, meaning yours as well as Redstone Arsenal's, and your efforts to protect or to maintain good personal hygiene, social distancing, and following through with the stay-at-home order, you are doing a fantastic job. Today, we are, as you all have heard before, we are seeing recoveries. We have more recoveries than we have COVID-19 cases here for affected Redstone Arsenal employees. So that means we're all doing our part. And I personally, I know Colonel Meador, Sergeant Major Jimenez, as well as General Daly and General Perna, we thank you for your dedication and for your work to take care of your own safety. Today, we don't necessarily have any updates to any precautions that the Arsenal has taken or any updates really from Fox. We are continuing to provide those necessary mission essential and critical tasks to the nation, and in turn, the Arsenal and Fox and all of our tenant organizations are providing the services, the human services to you, our workforce, as you come in, or to you as beneficiaries as you reach out to the Arsenal for us to deliver. You will notice that we have had a little bit of conversation on social media as well as on our Team Redstone website, and that is interpretation of the DoD guidance for face coverings. Well, it's not required for you to bring a cloth face covering onto the DoD installation, that being Redstone Arsenal. It is a requirement that should you exit your vehicle and enter into a facility and you're unable to maintain 6 feet of social distance, then you are required to put a cloth mask on or a cloth face covering. Now that could be your t-shirt, that could be a face covering. I will tell you what it's not, or what we'd ask it not to be. It shouldn't be a McDonald's bag. It should be a cloth face covering of good taste. And that, for lack of a better term, is your ticket to enter a location like the commissary or the PX or any of our gas stations or Class 6s. We ask you to put that cloth face covering on in those specific locations because we realize how difficult it is when traveling up and down those aisles to make sure that you're maintaining social distance. So to get into the commissary, the PX, the commissary, or any of the AFES facilities, you've got to have a cloth face covering. We appreciate it that you're taking care of that. We've seen plenty of creative masks, and we're overall appreciative. I just ask that we maintain our discipline. Have your mask in your pocket in the case that you need it. Other than that, I'm going to turn it over to Colonel Meador just for opening remarks, probably answer a couple questions. Thank you.
All right, thank you. Hey, good morning, Team Redstone, families, friends. Appreciate you coming in today with us to hear a few points. As Colonel Smith mentioned, you don't have too much to put out today. I do have a question here I'll answer for you, but a couple of admin points, if I may make that clear to everyone out there. First and foremost, I want to echo Colonel Smith's comments about Madison County and our local area here. You're doing a phenomenal job. in battling COVID-19. In my morning review of the Alabama Department of Public Health Surveillance website, which does a fabulous job of scanning the counties of the state of Alabama, today Madison County ranks 9th out of the state. A month ago, when Colonel Smith and I sat here before you, we were 2nd. So hats off to all of you out there for doing a phenomenal job. Just for your awareness, areas around the Columbus, Georgia, those counties surrounding that on the Alabama side, and Mobile County have had some surges and creeps northward, if you will, of numbers as the state continues to monitor that area. But you're doing an incredible job. Of our cases, we are 80% recovered, which is also an awesome aspect for those who had contracted COVID-19, and currently no hospitalization. So again, for the Redstone Arsenal population, everyone associated and family members, you're doing an incredible job. So keep it up. Doing really well. A couple of admin notes, given the storm systems we've had last night and that we are anticipating today. Originally, we closed our drive-through pharmacy up until noon today. We are going to go ahead and close it for the entire day. We're expecting this second round of storms today beginning around noon, which unfortunately is going to require us to close it for the entire day. So appreciate your understanding in that regard. Tomorrow looks very pretty nice, and we anticipate normal hours tomorrow, but I do ask you to keep up with our Facebook Live, our Facebook page, and our redstone.amed.army.mil page for latest updates. But again, we see no issues with tomorrow being open, so appreciate your understanding in that. And we understand it's an inconvenience. We do have some individuals who drive up, and we apologize that the message didn't get out, or if maybe it just didn't see it posted. But we do anticipate, again, a full day tomorrow. A little bit about that, just want to echo on some points that I made last week about the drive-through process. Just a reminder that for your new prescriptions, as you come into the facility area, if you have a new prescription, you're going to be directed in your vehicle up to the pharmacy entrance side of Fox, and that will take place right there as you're entering the Fox facility. I'll have a staff member there on the ground who asks you the nature of your visit, and assuming, or if it's a new prescription, he or she are going to direct you to up to a tent area. Again, you stay inside your vehicle. One of my pharmacists or pharmacy techs will ask you about your new prescription. They'll take your vehicle information, your phone number, and your prescription itself, and they'll direct you to park. And while we go inside and get that new prescription taken care of, or if there's an adjudication that we need to do about an issue you're having, we're going to do it right there. So far, I've received a lot of good feedback about that particular process. I think it's going well. I think the staff has done a great job in getting us more streamlined, and I see the line moving a lot more quickly. Have been over the past week or week and a half. So again, appreciate you and the time you're building into your schedule to accommodate that coming through. Also, with Colonel Smith, we've noticed a significant drop in traffic, in foot traffic, meaning those who are needing to come inside the facility. And that's just I think an awareness on the behalf of you all and your families, observing a lot of the governor's stay-at-home order, and in these times, we're noticing that across other military treatment facilities in the Army, that foot traffic has reduced. But as just an FYI for you. But again, we remain open for your acute appointments. Last week, we posted a color-coded key of what services are still open and in what services are limited to some degree. So ask that you refer back to that if you have any questions or understanding of what we're still doing. Again, invite you to come in. As I've said many times, we will screen you prior to coming in. And no matter what, you're going to get the service there that you came to receive. That in case you screen positive and we need to ask you a few more questions or have you checked out by one of our providers. Another reminder that refills, if you call it in or push it in through our online system, 24-hour turnaround. And we do ask you do come in the next day or within the 24 hours so that we can keep our refill prescription storage space freed up We've noticed that fills up rather quickly. So what that tells us is, one, that the process with which to get your refill called in is working well, and then also if we start to fill up, it just means we need you to definitely make a point to come in and pick up your refill. So appreciate you doing that. One great question here I want to go ahead and answer for you is we received previously. If Redstone Arsenal employees are to return to work, how is an asymptomatic person that has the virus going to be detected? I'll answer that. Take me just a minute here to talk through that, because it's a great question and illustrates a lot of things that we have here on the Arsenal. One, the situation that you're describing is currently not something that can be detected. That's part of the sort of the nastiness of this particular disease, is while you are asymptomatic and have the virus, you are exposing others. We don't have a way that can test for that yet necessarily, in the fact that understanding if you are asymptomatic. But what I would reveal to all of you out there, what we have here is we have evidence that our procedures of prevention are working. If you're sick, stay at home, maintain your distance, wear masks. We know the prevention measures are working, as evidenced by where we stand today as an installation and as a county. The other thing I would reveal to you is that should a person test positive in your area, we have a strong leadership network in place that involves your leaders, whichever command you're in, chiefs of staff. We have the Garrison command, of course, leaders over at Fox, and it's a very integrated network. And additionally, with that, we have battle drills that have been practiced, so to speak. So in case there is a positive person, Garrison's involved with sterilization or cleaning or backup. Fox is involved with reaching out to you for additional testing for exposures and whatnot. And your leaders are intricately involved to let us know, that being Colonel Smith and I, how we activate those various measures. So while there isn't necessarily a way to detect, a asymptomatic person unless we know they're positive already, what we have are, again, evidence that these preventive measures are working, and we have a strong leadership network in place with which can be to activate various things to ensure that if there is a positive person there, that we neutralize the spread, and we have a rapid effect there that has been practiced and has worked. So I'm proud to just bring those aspects to you and await any further questions you may have. Thank you.
All right. All right. Before I hand this over to Sergeant Major, I will handle one question. Mr. Hernandez, I appreciate your levity. The question is Redstone Arsenal, due to the storm, going to be closed today? And as you can see with us here, Redstone Arsenal is open and operational today. We are continuing to execute the nation's critical mission essential tasks today, even though it's storming. I'm going to pass off now over to Sergeant Major for some opening remarks, and then I'll get to your questions.
Good morning, Team Redstone. Again, thank you for tuning in to our social media here at Town Hall. A couple of things I just want to put out as we lean into this. I just wanted to say that please continue to adhere, just like everybody's been talking about the socializing and practices of the CDC guidelines, the state's order, and here at Redstone, the DECA and AFI's requirements to shop in there and wearing a cloth mask. We just ask you to continue to do that. Like the colonels have said, that it is really helping us out and doing what we're doing, and that's safeguarding the organization and safeguarding the community. Safety notes, before I get to the safety notes, there was a question about the commissary. The commissary is still open for shopping. We still are adhering to the retiree hours of Tuesday, Wednesdays, and Thursdays, and then open shopping Fridays, Saturdays, and Sundays. I want to put out that yesterday was Earth Day, so happy Earth Day. And then this is the month of the military child. So Really want to say thank you to the children out there for being resilient and continue to do what they're doing as they work through online education and taking care of their parents as well. Safety note, I am starting to see a lot of people exercising, walking and riding and running out there. And I just want to tell everybody to be safety conscious out there so we do not have any accidents while we're out there getting some exercise and we're out there driving around the community. With that being said, sir, I'll pass it back to you. Thank you.
Okay. All right. Hey, so I'm going to cover a couple questions that did come in, and then I've noticed a couple discussion points that you'd like us to go into some detail on. The first question is are the on-post gas stations open and running on their regular schedules? And I'll tell you that AFES is doing a fantastic job of continuing to deliver that essential service. The gas stations, both the Goss Road Express and the Martin Road Express are open and operational. Both are 24 hours if you use a card, and otherwise they are operating on their normal time schedules. I just caution you once again, if you are going to enter into the Express or the Shopette, please have your cloth face covering handy. So as you enter the building, you pop that on and pay your bill, get your conveniences, and head back out. The next one, it says, today I was entering the PX and I observed a service member in uniform being denied entry based on the fact that the time was reserved for seniors and retirees. This policy seems to me to be contrary to the purpose that the PX system was established. And as a retired officer of the U.S. Army, I'd always invite a service member in uniform to enter first. Well, I agree with you, sir. I appreciate that. However, in these times where a specific portion of our beneficiary population is considered more vulnerable to COVID-19 and the effects of COVID-19, what you see happening on the Arsenal via our retiree hours at the commissary and the PX both is we are affording our retirees or that vulnerable population to be able to enter into those two locations and be able to shop, one, with less people, a greater opportunity for increased social distancing, and to be able to enter those facilities without the younger population who most typically may carry COVID-19 without being detectable or asymptomatic. So we allow the retirees that time to shop. And as a green suitor, I am honored to be able to allow someone who has served their 20 or 30 years and retired in good standing. I'm honored to let them go shop in safety and wait and use my time later. So I know that Sergeant Major feels the same way, as well as our senior leaders. This is the one point in time where we get the opportunity to say thank you to our retirees and afford them some special care for their safety and well-being. Along the same lines, question for shopping at the commissary. Concerning shopping at the commissary, after the retiree hours in the morning, people notice that toilet paper is never available. Is the commissary restocking as normal? So I'll tell you that the commissary actually has adjusted how they restock. So acknowledging that the retirees get first entry in the morning, Tuesday through Thursday. What Mr. Somerville and I have worked to do is we put an initial stock on hand out in the mornings, and we'll stock the night before for the morning rush. The retirees get their opportunity to shop, and then Mr. Somerville and the commissary staff restock the shelves with the remaining items. What you are experiencing, particularly with the paper products aisle, is a nationwide shortage of paper products that translates to a shortage not only in our commissary, but a shortage of paper products as well as PPE, personally available PPE, a shortage in all of our stores throughout the community. But I assure you, I have been into the commissary both during retiree hours and during other hours, and I have witnessed paper products on the shelf, albeit they don't last long. And that's why I encourage you, our senior leaders have encouraged you, is please only buy what you need. Those of us who are going in and stocking up, we're only continuing to create the problem. So I ask you, please buy what you need. We will get more in stock, and it'll give us the opportunity to restock those shelves so that your shopping experience, your convenience is back to normal. And the sooner we do that, the sooner we can get it back. The next question, these next couple questions really get to a underlying concern across the installation of what to expect in the next step, the recovery. Nationally, you've heard in the media discussion of recovery and moving forward. And while I will tell you that Redstone Arsenal is not there yet, you'll know that our community and other communities within Alabama have gotten or have believe that they are in a position to enter what nationally is called phase 1 of recovery. At this point, the state of Alabama has not elected to begin that yet, and the stay-at-home order is in place. But I assure you that your tenant leaders, as well as Colonel Meador and myself and Sergeant Major, we are actively planning for how we will do that. What you witnessed over the past month and a half was you witnessed a set of precautionary measures that were put in place based on the effect COVID-19 was having on our community. And as we detected that COVID-19 was becoming more prevalent, what the installation and your community did was put in place prudent steps to encourage social distancing, to limit the number of people that could be exposed to the virus, at least in your workspace. And you watched us take measured steps throughout the process to get where we are today. And I assure you that the methodology that we use will, one, be synchronized with the community outside of Redstone Arsenal and throughout the state. And it will be based on how our population is interacting with COVID-19. We will take measured steps to bring ourselves back to normal. The question I have is, do we anticipate a spike in positive cases when everyone returns, and how will we prepare and react? Large groups to gather, and all of those facilities are difficult for us to enable you to maintain good social distance. So you should expect that those facilities where large groups gather or are encouraged to gather, that those facilities will remain closed for an extended period of time until such time as, once again, the virus is abated and it's more prudent for us to allow larger groups to get together. Now, rather than me continuing to answer a bunch of your questions, I noticed Sergeant Major's got a couple pink slips, and so does Colonel Meador. So I'm going to pass over to Colonel Meador for the time being.
All right, thank you.
Yep.
All right, I've had a couple of great questions here I'd like to address for you and clarify some points here. First one is, are new personnel arriving on post required COVID screenings? And the answer to that is no. We understand Department of the Army is continuing to refine policy for soldiers and families who are returning from overseas. And we understand that they're looking at quarantine measures on how to do that and where those sites are currently going to exist. But the answer to that is no. But I will caveat that for a couple things. One, if you're feeling ill, remember, we do have acute appointments. If for whatever reason you're newly arrived to the Arsenal and you're a beneficiary at Fox, we do ask you to come in. We screen everybody at Fox. And based on some, or how you answer your questions or based on a temperature check, you are what we call positive. You screen positive, which means they're going to take you to a different area of the facility and evaluate you a little more closely and continue to understand how we can help you and maybe see if there's any other issues we need to do or potentially test you for COVID-19. So that was a great question there. Another question I have here is, when will we be able to schedule EFMP appointments again? Another aspect of Army policy we're tracking, and actually DoD policy, I know everyone saw recently that the stop move was extended till 30 June. That does not preclude the look and the screening EFMP wise if you are on orders, or for those who are on orders to come here. What I would ask you to do is call in for an appointment. There may be an initial screening given your case or where you're going, or the situation with your family, that some things can be handled over the phone. Or we set up an appointment for you to come in and sit down with our EFMP nurse to get your packet prepared and ready to go. So quick answer to that is just please call in so we can get the time lined up for you. There may be some initial aspects of your case that we can do over the phone and followed on by an appointment. So great question there. Another great question we have here is, does Fox Army Health Center provide telehealth services? We do. And it depends on what exactly the particular instances and what we do to extend the telehealth service to you. We have a lot of great avenues we're conducting right now between physicians and patients, secure messaging. I know some of you have been using that very well. And, with all of my physicians and nurses still on staff to help you in that regard, they can establish some methods that we could execute telehealth. But it really depends on the situation at hand or what the case is, particular with that aspect of your health that we want to get looked at and further evaluated. So, again, another great question for you. I think at that time, that's it for now.
Okay.
Thank you.
All right. Well, I'll move back to a couple questions here. That this first question is very similar to asking when the gym will open or when the chapel will open back up. And it asks, when will the CDC and Youth Center reopen? Well, today the CDC is open, as well as school-age services. They're open to service mission essential personnel. So if you're required to come on to the installation to provide your specific skill to your effort today, and you're mission essential, then we welcome you at the CDC or the school-age services. As we proceed forward and we make adjustments to recover, and as our patrons and their children need return back to work, our CDC will expand the capability in order to re-welcome those previous customers and to have a spot here at Redstone Arsenal where we can take great care of your children. Our CDC continues to be operational, and as the workforce returns, we will expand that capability to receive you. But that will be in the measured, phased approach as we proceed forward, and as we find those the ability to reopen that in a safe and secure manner. The next question is, these are all realistically about coming back to work, and so I'd ask that you listen keenly, I guess, and understand that it's difficult to provide you a great answer or a specific answer to each and every one of your concerns. As we've said, when the time comes that we come back to work, we'll do so in a phased manner. And I will assure you that the senior leaders throughout Redstone Arsenal and throughout the Army really are taking into account how the virus spreads, and specifically that the more people we have gathered in certain areas, the more chance of infection. And so as we do come back to work, your leaders and the Garrison and Fox will be doing all we can to continue to encourage social distancing. What that might mean is the question I have is what happens when working together in a cube farm that doesn't allow 6 feet of separation? Well, while I can't tell you what will happen specifically within your organization, what I can tell you is that our tenants today are making effort to put plexiglass dividers between cubes that are unable to maintain 6 foot of separation. Additionally, we are only bringing to work a number of people that could arguably, in this case, could allow separation. One person in one cube, an empty cube, and then another person in another cube. So each individual organization is tailoring how they respond based on their workforce and the layout of their office. So far be it from me to be able to predict your specific situation, but I can tell you that your leader is taking it into account. Whether that means issuing of PPE for those people that cannot maintain 6 foot of separation, or whether it's coming up with an alternate work schedule where A team comes to work for these hours, B team comes to work for these hours, and C team comes to work 4 hours later. Your leaders are creative and innovative, and they want nothing more than to keep you safe and secure and to help us to combat COVID-19 and the spread. The next question is, when can we expect to return to work, and will it be a phased-in process? I think you've already heard us say that while we can't predict when each of you will return to work or when Redstone Arsenal will be back to normal operations, what we can tell you is that yes, it will be a phased approach. It's conditions-based. It will be tailored to ensure that we do not encourage the spread of COVID-19 and that we protect our workforce. Question very similar is the Garrison waiting on the state's stay-at-home order to end or waiting for health level to move back to Bravo and Alpha? What is the determining factor? Well, I will tell you. So Redstone Arsenal, our senior commander, General Perna, General Daly, they, along with Colonel Meador and I making recommendations, determine which health protection condition Redstone Arsenal is going to observe and which precautions we are going to observe. It is tailored, protection categories or conditions are tailored to the specific organization, the specific installation, and the specific environment. We've done so to this point, and we will continue to do so in the future. It is conditions-based, and it is a phased approach. What you're likely to see is us to select some conditions or some precautions that we either relax or increase. You're likely to see us do that for a period of time to observe how our population and the virus react, and then move to a different condition. As you've seen so far, I try to relieve your anxiety to know that what you have experienced so far is what we will continue to experience in the future. The good news is that as Colonel Meador explained, is we have practiced battle drills. We have cleaning agents and PPE on hand. And we have established some great processes with your leadership and with your facility teams to ensure that we have the ability to react and, better yet, to be proactive and help protect you. As far as are we waiting for the state stay-at-home order to end? As you know, Redstone Arsenal and U.S. government operations are not impacted by the state stay-at-home order. So Redstone Arsenal is not necessarily required to be at a reduced capability. However, we realize that our workforce, our population lives in the community around us. We rely on the healthcare services in our community. And so we are matching our stay-at-home or our COVID-19 response to those communities around us to ensure that we remain synchronized. It's for the health of the larger community, not just our employees, and we will remain synchronized with them. So should the governor adjust or amend her stay-at-home order, Redstone Arsenal will study that and make recommendations to our leaders of what we should do next, and we're prepared to do so. Now, I think, the last question I have is, will commands make people go home that are sick? Those people that are sick and won't go home. Now, I think that's kind of a loaded question. Once again, I can only speak to what Redstone Arsenal, the Garrison, what our policies are. I can tell you that it is universally accepted throughout Redstone that if you're sick, you ought to stay at home until you can be evaluated by your primary care manager. But today, there are quite a few folks with sniffles and coughs, and that is related to the weather bug that you continue to get a warning from, which tells you that the pollen count is high. So what I'm telling you is that if you're sick, you need to stay at home. You need to go see your PCM. But just because you've got the sniffles or a fever doesn't necessarily mean you or your neighbor has COVID-19. What you ought to do is you ought to continue to monitor yourself, check in with your primary care provider, and if and when your primary care provider says you've just got a reaction or an allergic reaction, you can go to work. We all need to understand that our neighbor, the person working next to us, is being responsible too and coming home or going to work. And that the leaders in your organization are actively assessing. And if they see someone who's sick, they'll probably ask them if they've seen their PCM. And I am assured that each one of us is being accountable for ourselves in order to ensure that we all stay safe and COVID-free. Now, I don't have any additional questions, and it looks like the question bank, here comes Julie. Let's take a look at what we have. Simple question. Once again, when will gates 3 and 10 reopen? So I had actually posed that question back to you. And I would welcome anyone in the audience to answer that question for me, because I think at this point we've expressed how we make those decisions. So I'll just say that gates 3 and 10, the reason we closed gates 3 and 10 is because we have significantly less demand. Our installation is currently operating at somewhere around 20% of the population comes to work each day. And so what we've done is we've closed gate 3 and 10 in order to allow us to keep our guards at home, keep our guards in reserve, so that if any other guards get sick, we have a pool of guards to call on in order to continue to deliver services to you. At the point in which we grow the population that comes to work each and every day, we will grow that capacity and reopen lanes and reopen gates. Much like as we bring people back to work, we will gauge the demand and bring back people to work at the CDCs or work in the cafeterias or open the one stop. But that will be based on demand, and that demand, bringing those people back to work, will once again be based on COVID-19 and the number of folks that we can continue to keep COVID-19 free. Now, I think I've answered just about every question on there. Do you have any more, Colonel Meador?
No, thank you.
Sergeant Major?
I'll address one, sir.
All right.
And it's really kind of the same basis that you've been talking about, sir. One of the questions that came in, is there a timeline that has been established to come back to work? And will there be some protocol to come back? And just like the Colonel talked about, there is no set timeline. It will be a phased approach. And the leaders and tenants are all looking at it to ensure that it's being planned and assessed to bring back everybody safely in a phased approach. we just need you on your end to continue to do what we've been talking about, do what the CDC has been talking about, and do what the state has been talking about to safeguard everybody. And that's, continue to social distance. And if you can't, wear some type of cloth to protect your face and the nose and keep everybody else safe. The Colonel talked about, our custodials are doing an outstanding job out there as they go through all the buildings and cleaning all the touch points and preparing for everybody to slowly come back. Other than that, thank you, sir.
Okay. Colonel Meador?
Thank you.
All right. Hey, so I'd love to comment on this. I'll tell you that I had been resistant to doing a Facebook Live town hall for a long time now. But I will tell you that I owe every one of you listening today a sincere, heartfelt thank you. You have helped us to ensure that our workforce remains informed. You have helped us to kill the rumors and provide accurate information to our anxious workforce. You cannot have courage without fear. And you all are doing your reading, you are listening well, and when other people have questions, you're answering with truthful, factual answers, and that helps all of us to get better. That helps all of us to remain safe. So thank you all for being here today. Thank you for the questions that you're asking. And most of all, thank you for educating others and helping each one of us get ready for the next day. I look forward to seeing you all back here on Redstone Arsenal in the near future. Stay safe. Practice good personal hygiene. If you're sick, stay at home and follow the quarantine orders. Thank you very much. Have a great day.